In case you don't know, September is Childhood Cancer Awareness Month, focusing on helping and raising awareness for those who currently are patients and survivors who were diagnosed as children. Luckily, a lot of progress has been made in doing just that. And here to talk more about raising awareness, the successes and challenges, of course, in childhood cancers are Dr. John Kuttish and Dr. Ko Boyu, as well as Shanda D'Antonio, pediatric nurse with UNM Children's Hospital. Good morning to you all. Thank you for coming in this morning.
Thanks for having us.
So let's first talk about September being Childhood Cancer Awareness Month, and why September?
Well, the National Legislature of the United States, recognizing that children do get cancer and that the impact of childhood cancer was on families and communities, decided to find a month within a year that will focus on recognizing these facts about childhood cancer. And we know that 1 in 720 person in the United States is now a survivor of childhood cancer.
Did you say 1 in 750?
750.
750?
Person greater than 20 years old is a survivor of childhood cancer today in the United States.
Wow, that's
Making
interesting.
that a very important fact for us to know as a community. And these children, as they survive with complications of their treatment and their disease.
That's
So
interesting.
we at the University of New Mexico find ourselves wanting to educate our communities
Sure.
that we have this situation and we should help these patients and their families to cope with these conditions resulting from their diagnosis
And
as children.
I'm sure as doctors you all have seen, at least I hope, some positive response to and action come from this awareness campaign.
It's really been helpful. Again, childhood cancer is the second most common cause of really child fatality and death.
Yeah.
The thing is that making the community aware of childhood cancer, one is the support. These families need great support.
Sure.
The community needs great support for this.
I mean,
because-
cancer itself, it's a difficult thing to go through, and
Yes.
especially, I mean, when you're dealing with a child too, sometimes
Right.
even more sad and something to think about. But I want to talk about clinical research and what that has played in terms of improving survival rates. First off, what is clinical research?
Clinical research spans from really studying the cancer, studying the child's cancer, studying the child. Clinical research includes really clinical research trials that basically are studying new drugs with standard treatments, trying to improve outcomes or how well the child does. And so it can take the aspects of trying to find out how well the patient is doing. One, is the patient taking their medications or oral medications? Are there things, other supportive things that we need to do? We worry about infections with the treatments.
Sure.
But in the long run, the clinical research has resulted over the last 50 years from survival of 5% to over 80%.
Wow, that's a significant change.
Yes.
That is a significant change. So does that mean that less people are seeing the cancer return? I mean,
Much
that would be a
less.
big question, I think.
Much less people. Again, as we say, survival is 80%, and it's increasing now as we discover new treatments and we learn better ways to take care of these patients.
What are the real chances of these people developing the cancer again, though, once they've been diagnosed as a child, but then they're considered survivors?
Again, it's about 15, 20%.
15,
lifelong.
20%. Wow. So I understand that there is a multidisciplinary approach. That's, I guess, how it's being defined when it comes to researching and helping out these patients.
Yes.
You know, people don't realize when a child gets diagnosed with cancer, how many, things it affects. The families have to be there pretty much 24/7 with the patient while they're in the hospital.
And it's
It
like a
affects-
family disease, right?
Right, it
Yes.
is. It affects, your job, these parents' jobs.
Yeah.
emotionally. There's a lot of different things. So people think that, childhood cancer is a very simple thing, and it's not. I mean, really, you need social workers to help these families through the things they're going through, and then we have the nurses. And I'm a oncology nurse, so it's the nurses really bond with these families.
Sure.
And so you have the nurses, your New Mexico Cancer Fund. There's a lot of different people that are involved in the care of these children. So
The community plays such a crucial role
Right.
It
in all
does.
of this. What are ways that people can help out?
Well, there are different ways in which people, the community, can help out these patients and their families. They can do so, even though September is the National Childhood Cancer Awareness Month. Our hope is that people will be aware that this is ongoing all year.
Sure.
And September is just the time we'll all come together to recognize it officially. But they need your support by contributing funds to research. Like the UNM Cancer Center does a lot of research into childhood
Sure.
cancer. They need your support if you're an employer to understand that the parent has to be at the hospital and to
Taking
still
time
meet,
off from work.
taking time off from work. They need your support in just recognizing that the child is, even though they may have completed the treatment, they still need follow-up. You are just asking the chance for recurrence.
Sure.
We follow these kids long-term to study them and see how well they do, how many of them go to college, how many of them become parents, because the treatment affects them in different ways.
Sure, there's different effects, as you mentioned
Exactly.
at the
So
beginning.
we think that when the community knows that children do get cancer, when the community is aware that we do have a childhood cancer program at the University of New Mexico, it makes it, it brings it home to them.
Sure.
You don't need to go out of the state to get care. And at this point, Elizabeth, if you allowed me to just mention the Children's Oncology Group.
Yes.
The Children's Oncology Group is the largest group in the United States, and I think even the world, that takes care of children with cancer.
Sure.
More than 90% of the children diagnosed with cancer in the United States are treated on protocols developed by this group. It contains more than 210 hospitals in 6 continents.
Wow, that's huge. Thank you all for coming in, shedding some light on this. Of course, for a recap of all of this, for more information on Childhood Cancer Awareness Month, it is September, but as you mentioned, this is an issue that affects us all year long. Go to our website right now, krqe.com, click on links. Thank you. We'll be right back.